All right, good afternoon. Good afternoon, everyone. Thank you for being here. Joel, are we ready to go? We're ready to go. All right, sounds good. So thank you, everybody, for coming. This is the Health and Social Services Subcommittee of Appropriations. Today we are hearing the budget of the Developmental Disabilities Administration. We will start with there's a lot of folks here today, so I want to sort of at least go through the process so that everyone's familiar. We're going to start with the DLS analyst and the analysis that was provided for the budget. We will then go to the department for their report and response to the analysis, and then we will go to our witnesses. I believe we have hang on, just checking. 1, 2, 3, 4, 5, 6. We have 6 witnesses, so we'll take you in 2 panels, 3 each, to testify. So that is the way we're going to do it. We're going to start with the analysis from Morgan.
Thank you, Mr. Chairman and members of the committee. My name is Morgan Smith, and I'm presenting the operating analysis on the Developmental Disabilities Administration today. As you may know, DDA provides direct services to intellectually and developmentally disabled individuals in the state of Maryland, and that includes through facilities and community-based services. And on the first page, you'll see the operating budget summary. In fiscal 2024, DDA's budget increases by $93.1 million, or 5.3%, to $1.86 billion. We're going to skip now to page 5. Page 5, Exhibit 1, shows the number of individuals served by DDA across all DDA waivers. One of DDA's primary goals is to increase the number of eligible individuals receiving community-based services and enrolled in a community-based waiver by 0.3 percentage points over the prior fiscal year. Enrolling individuals into an HCBS allows for claiming of federal funds for services provided, and as shown in Exhibit 1, fiscal 2022 saw 17,186 individuals receiving community services enrolled in DDA waivers, and that was an increase of 3% over the last fiscal year, which it grew from 16,716 individuals. However, the total number of individuals served in community services outside of those receiving case management also increased significantly from 17,112 individuals to 19,506 individuals in fiscal 2022, and that caused the overall percentage of those served in DDA waivers to decline from 98% in 2021 to 88% in 2022. This is the lowest level of individuals served in DDA waivers since 2018, where the percentage had also hit 88%. Because of this, DLS has asked MDH to comment on the reason for the slippage in the share of participants qualifying for the waivers and efforts to increase the percentage of individuals served in all DDA waivers. To that end, DDA offers 3 waiver programs under Medicaid. These include community pathways, community supports, and family supports. The difference in these waivers and the numbers of individuals utilizing them are listed at the beginning of page 6. DLS asks MDH to provide an update on the current number of filled and available slots, as well as efforts to fill remaining slots for these waivers. On page 7, Exhibit 2 is titled Point in Time Community Services Waiting List Counts. This shows the waiting list counts, and it is collected throughout the year. DDA tracks the waiting list of over 3,800 individuals who meet the statutory requirements of having a developmental disability, and you'll notice that these are broken into 3 priority categories. Crisis resolution is the highest need, and those who are in crisis resolution are typically at risk of harm or homelessness without services, and that's in comparison to current requests, which is at the bottom of that table. And those are individuals with the lowest level of need, and they are typically not at risk of harm or homelessness without services. In recent years, the number of individuals on the waiting list has been decreasing, but in fiscal 2022, the waiting list saw an increase of 0.7% to 3,805 individuals from the recent low of 3,777 in fiscal 2021. There are also individuals who only receive support services, and those are individuals who do not meet the statutory requirements of having a developmental disability. While they are not included in this graph and table, I wanted to mention that including them in the total number of individuals on the waiting list brings the waiting list up to over 6,000 individuals. And so DLS is asking DDA to comment on the status of the waiting list and efforts to reduce the waiting list. We're going to move now to page 8. Page 8, Exhibit 3, shows the balance of the waiting list equity fund. This fund was originally established to ensure that funding associated with individuals who were served in state facilities followed them when they transitioned to a community-based care setting. Exhibit 3 shows the increase over the last 5 fiscal years of the fund, and it increased primarily due to low spending from the fund. Between fiscal 2021 and 2022, the fund saw the smallest growth between years in recent history at only a little over $617,000. But right now in fiscal 2022, the balance was about $12 million. Starting on page 9 and onto page 10, talks about the proposed deficiency appropriations seen by DDA in the fiscal 2024 budget that will be provided for fiscal 2023. To give a little bit of background, the American Rescue Plan increased the federal Medicaid assistance percentage for qualifying Medicaid home and community-based services spending by 10 percentage points, and that's between April 1st, 2021 and March 31st, 2022. The amount of the match that the state is being provided must be reinvested in home and community-based services by March 31st, 2024. Language in the fiscal 2022 budget required DDA to spend at least 75% of these federal funds attained from the enhanced match for a one-time rate increase for home and community-based service providers, with the other 25% being used for certain purposes. DDA had initially planned to set aside $10 million for competitive grants that would have been created with these federal fund savings. The Centers for Medicare and Medicaid Services subsequently reported the DDA grants could not be used for capital investments or ongoing internet connectivity efforts. And then DDA reported in its most recent spending plan that it would amend the amount originally set aside from $10 million to $5 million. This $5 million deficiency is included in the fiscal 2024 budget, and its purpose is now listed to assist providers who are transitioning to the new long-term supports and services system, also known as LTSS, in obtaining equipment and information technology software. To this end, DLS requests that MDH comment on why using the ARPA funds for competitive grants for IT infrastructure is a permissible use of funds, including whether other uses could have been considered that would have resulted in a federal fund participation. Additional deficiencies are listed in the middle of page 10, and that includes $17.7 million in federal funds for the remaining portion of the enhanced federal match before the phase-out, as well as grants for post-secondary education and support for the projected shortfall in community services due to higher spending. Moving to page 11, Exhibit 4. Exhibit 4 shows the overview of agency spending in the form of a pie chart. The majority of DDA's budget is dedicated to provider payments within community services at about 99%, with the other 1% being used for program direction. Within the 99%, about 57% is used for residential services, and then additionally, in the fiscal 2024 allowance, there is increased spending for self-directed services as a result of Chapter 736 of 2022, with an additional increase budgeted at $15.8 million in general funds. Just to note, overall, self-directed services account for about 10% of the budget at $191.3 million. We're now going to move to Exhibit 5 on page 12, and it moves also on to page 13. This shows the proposed budget changes for DDA, and most of the change happens within community services. This includes $117.5 million to cover the expansion of waiver services, new placements, and the 4% provider rate increase, which is at about $66 million. It also includes $20.8 million for an increase for day and residential services providers for their transition to LTSS, as well as a day and employment transportation increase. At the bottom of page 12, you'll see a discussion of personnel data at DDA. In fiscal 2024, DDA gained 5 positions, which were primarily represented by a realignment made within MDH. It also includes a net increase of 14.09 contractual full-time equivalents. Starting on page 14, we'll walk through some of the issue discussions that are included in the analysis. First, there's a discussion of language that was in the fiscal 2023 budget bill, which withheld $1 million of general funds that were used for administrative purposes in DDA pending the submission of quarterly reports. And those quarterly reports were surrounding community services utilization, data collection, and spending forecasts. The first report was submitted on July 13, and the funds were released on August 25th. However, the second report, while submitted on November 1st, was found to have insufficient information, and the funds were continued to be withheld. As of the writing of the analysis, the third quarterly report, which was due on January 1st, still had not been submitted. And the information that the reports were to include are listed on page 14 in the bullets. Moving on to that status of transition section at the bottom and then on to page 15, DDA is moving from a prospective payment model to a fee-for-service model, which includes moving billing functionalities from the legacy provider consumer information system 2, which I'll refer to as PCIS 2, to the long-term supports and services system, LTSS. LTSS is already being utilized by other Medicaid programs across the state. MDH continues to transition individuals and providers to the new LTSS system for billing, and as of September 1st, 2022, 70 providers and 5,969 participants, or nearly about a third of total DDA participants, had been fully transitioned. You'll see that total and the timeline of folks transitioned in Exhibit 6 on page 15. As DDA has not yet provided a timeline for additional transitions, MDH is being asked to comment on the updated timeline to transition individuals and providers to the new LTSS system, the share of providers and participants who have and will need to be transitioned, and the projected date for completion of those transitions. Subsequent to the submission of the quarterly reports, DDA shared provider population data on those who had transitioned to LTSS, and that's shown on page 16, Exhibit 7. Exhibit 7 shows both providers transitioned to LTSS as compared to the total number of providers by size. And you'll notice that there is a higher portion of large providers who have transitioned to LTSS to date, with about 51% of all large providers having been transitioned. In comparison, only about 17% of small and 23% of medium providers have transitioned in the same timeframe. The Hilltop Institute also completed a fiscal impact analysis to examine the difference in payment to providers between PCIS2 and LTSS. The analysis received data from about 84 DDA providers who voluntarily self-reported information. Hilltop notes that in this report, because of the fact that it was voluntary and that the providers serviced were self-reporting, the information is not necessarily a random selection, nor is it necessarily representative of all providers in the system. Between the models, the new LTSS system has showed an increase in the average reimbursement to providers by about $1.41 million, or 18.2%. And it's important to note that day providers were an outlier in this information and reported an average decrease of about $90,000 per year. We'll move now to Exhibit 8, that's on the bottom of page 17. Exhibit 8 shows a cost analysis of the rates paid to providers that were transitioned, and it shows about 588 consumers or 5 agencies that were part of the early adopter group. The revenue that the providers received in LTSS was 32% higher under LTSS than they would have received in PCIS2. And because of this, DLS has asked MDH to comment on the generalizability of the data to the larger provider population and the expected impact on state revenues as a result of the transition to the fee-for-service model, including whether the fiscal 2024 budget contains adequate funding to support providers who have or will transition to LTSS. And in addition, in previous reports, MDH provided a description of the utilization and spending data that is available through the LTSS system as it relates to ways in which LTSS provides the electronic exchange of data for DDA users. It is unclear if providers, case managers, and other individuals participating in the coordinated community supports arena can utilize the ability to exchange data. MDH should comment on whether all individuals who collect billing data can utilize the data exchange features currently, and if not, when those features will become available for use for all participants. And then lastly, moving to page 18. In October 2022, an audit was completed by the Office of Legislative Audits, and it found that DDA lacked adequate procedures to ensure that services were rendered to consumers and that provider payments were billed properly, in addition to some other items. And on page 18, you'll see a bulleted list of the recommendations that were offered by the Office of Legislative Audits. DLS recommends adding language restricting funds pending the resolution of repeat audit findings. This is consistent with previous requests of the Joint Audit and Evaluation Committee when an audit contains 4 or more repeat findings. Moving now to pages 20, starting on page 20 and through page 23, there are additional recommendations made by DLS that I will walk through briefly. Item 1 recommends restricting funds and community services that would be utilized for the transition of additional providers and consumers to the LTSS system until MDH submits a report to the budget committees detailing the number of providers and participants that will be transitioned, as well as a forecast on the estimated increase in payments as a result. And this item would be due July 1, 2023. Item 2 is annual language that requests continued information on the transition to LTSS, including general fund forecast, utilization by service type, the number of individuals transitioned, a cost analysis of rates paid to providers as compared between the 2 payment models, a breakdown of providers transitioned by size, and an updated timeline for transition. This again would have a restriction of $1 million that would be broken down into $250,000 per quarterly report that is submitted. Item 3 is the previously mentioned language from the repeat audit findings. Item 4 would restrict $100,000 until a report is submitted that explains the decline in community services participants being served in all DDA waivers. And this is primarily because MDH is losing access to additional sources of funding because when individuals are not enrolled in waiver programs where federal fund reimbursements are provided, we are not receiving that federal fund reimbursement. And lastly, item number 5 is annual language that restricts the appropriations made for community services to that program specifically. On the following pages, you will find updates on the federal disallowance, JCR reports, audits, and other appendices. And with that, I conclude my testimony, and I'm happy to take any questions you might have.
Thank you, Morgan. Any questions for the analyst? All right, seeing none, let's bring up the department, Secretary Herrera-Scott, and your team. Good afternoon. Welcome.
Good afternoon, Chairman President. I'm sorry.
You wouldn't be the first. It's okay.
And members of the subcommittee, Laura Herrera-Scott, Secretary of Health for the Maryland Department of Health. With me is Bernie Simons, Deputy Secretary for the Developmental Disabilities Administration, and our Chief Financial Officer, Emily Brandenburg. Also available are Robert White, who is our Operations Director for DDA, Nicholas Gabor, our Finance Director for DDA, and Webster Yee. I want to thank Ms. Smith and the entire DLS Budget Analyst Health team, as always, for your analysis. I want to take a moment first to thank Disability Secretary Carol Beatty and Bernie for their steadfast leadership and work together in recent years. I look forward to continued collaboration with state agencies as a valued partner, some of whom are sitting behind me on the work that is yet to come. I'm committed to DEA's mission of creating a flexible, family-oriented system so people can live their full lives. And, you know, see the mission coming to life, although I know there's still a lot of work that needs to be done. Person-centered practices are rooted in health equity, ensuring people can access the services they need when they needed a shared goal of DD stakeholders, the department, and certainly Governor Westmore's, especially given his goal to leave no Marylander behind. But before I turn it over to Bernie, I just wanted to touch on a few highlights in our budget response. My North Stars always and will be what is best for the individual. One of my principal goals over the next few months is to really understand DDA wait lists so that we can minimize wait time and get as many people the services that they need. Similarly, with now approaching some key points in the transition from a prospective payment system to a fee-for-service via the LTSS DDA module, and ensuring a successful transition is a priority for this administration. With that, I'll turn it over to Bernie, who will go through a summary of our response to the DLS analysis and provide it.
Thank you, Secretary. Chair Resnick, Vice Chair, members of the committee, I'm Bernie Simons, Deputy Secretary for DDA. It's good to be here again, and I'll go through a list of questions that you have asked, and the first one was MDH should comment on the reasons for the slippage and the share of participants qualifying for the waivers. So we pulled the data also and looked at it, and I know that there was a call with DLS Morgan over the weekend, and we're not seeing slippage, so we really need to get back and figure out what the data points are. I would speculate something, but I really don't like to speculate, but we're between two systems. We're between the current PCIS system and the LTSS system, so I'm not sure that there might not be an issue with the data with the way it's being pulled. So again, I respectfully ask that we would have a follow-up meeting with DLS, and then we will provide additional information to the committee. MDH should provide an update on the current number of filled and available slots, as well as the effort to remain. We have, between the three waivers, as the analyst said, we have the community supports waiver, the community pathway, and the family supports waiver. We have a total of 19,435 slots among those three waivers. We have 18,149 filled. That's a 93.4% a fill rate for us. And so we also have what we call reserve capacity, which is basically for a population. If you may recall, back a few years ago, DDA had a bill about families who were in the military who moved out of state or reassigned out of state in their military capacity and then came back to Maryland. And we didn't want to put them on a wait list. So that's one of the examples of what reserve capacity is. So we've got people who are court ordered. We have people from the State Department of Education, MSDE, that age out, are transition and youth. So all of those people would go on a waiting list if we didn't have the reserve capacity. Having said that, the total amount of available slots that we have among the three waivers is 133 out of the 19,435. So, we'll continue to work with the waiting list that we have. As of right now, in our crisis resolution, as the analyst mentioned, we have crisis resolution and crisis prevention and current request. Crisis resolution, we only have 2 people on that list. On crisis prevention, we have 176. And I'd just like to point out that for those 2 groups, over the past few years, and back in 2017, we had 780 people on the waiting list. In 18, we had 721. We then dropped to 519. In 2020, we got down to 215. In 2021, 182, and now we're at 178. So we've been seeing progress in taking people off the waiting list. We also appreciate the support we've had for the community support waiver and the family support waiver that we initiated back at the end of 2018. We think that that's made an impact on people coming off the waiting list. The next question is MDH should comment on why using the opera funding for competitive IT grant infrastructure is permissible. In our spending plan approval letter from dated December 12th from the U.S. Center for Medicare and Medicaid Services to provide that, they gave us approval to do that and move forward. I think one of the areas that we were concerned about is with providers transitioning from the current platform of PCIS2 into LTSS. We've heard from providers early on who have moved in, whether it be fully or partial, that there is a need to change their IT platform in order to collect the data, since we are going into a fee-for-service system. And we should have those competitive grants out relatively soon. As DDA has not yet provided a timeline for additional transitions into LTSS, what will that look like? Basically, we are saying that we had 55 providers that went in April through September. And by the end of next year, December 2024, all providers should be in LTSS. And so we've got good progress. I can say as of today, we have, well, I should say, let me back up. As of November, we had 174 providers who were either all in or partially in LTSS. And we are in another transition phase for January, February, and March, and April of this year. And we'll go from 174 to 191 providers that will be in LTSS. So I think we're making pretty good progress as we move along. We will continue to engage with providers to make sure that they've got the appropriate infrastructure like IT for billings, because it is so much different than what we have in our current system with PCIS2. So again, I think we're making good progress, and we've got 12 months from next year, and we've got a handful of months left this year for us to continue to move forward and engage with providers. DDA should comment on the data of the larger provider population expected to impact the state expenditures. And what does that look like? There was, I think, a recommendation to use the early adopters of the 5 people. We really think that that's too small. We know in our JCRs that will be coming up, we will have more data points available, and that should give us a more reliable predictability of what those funds would look like. We should comment on whether all individuals who collect billing data can utilize the data exchange. Yes, all billing data is available to providers in the same manner as all other fee-for-services and Medicaid providers. And the last is DLS recommends adding language restricting funds pending resolution of repeat findings, and the department concurs. That ends my presentation.
Thank you. Any questions for the department? Seeing none, I have a few. So the second to last answer about the data exchange, your answer says that all data is available. Several providers, specifically Coordination of Community Service Providers, have said that that's not accurate, especially for case managers, that they do not have access for data transferability. And we would like to get that to mesh, because obviously it is within statute that requires you to provide that data access. So can you comment on the difference of opinions in this case?
No, I really can't, because I mean we work with LTSS and Medicaid, and as I said, all Medicaid providers do the fee-for-service. Obviously that would take, I think, an IT expert to figure out what would that relationship look like going back and forth. Okay. In being able to. We do have multiple reports that Maryland MPS, Medicaid Provider Services, provides to all providers that have access to all kinds of data.
Okay, but I mean specifically the data exchange with LTSS.
So, as Bernie said, we're going to have to take that one and get back to you on that.
Can I have those specific providers reach out directly to you all and see if we can? It could just be a technological glitch, but we want to make sure that that's actually happening.
Yes, absolutely.
Wonderful. My follow-up question is, I know that last year, and this was department-wide, not specific to DDA, but it included DDA, there were issues with getting payments out the door and paid, approved invoices that fell behind in terms of actual payment. I understand much of that has been cleared up, but I am still getting reports that there are still some delayed payments for approved invoices that have not been moved out in appropriate periods of time. Do you have any sense of where we are with that?
Could you,
I'll
yeah,
take that.
okay.
So you're right, the payments were delayed, and exactly what you said, my understanding is that we are caught up. Now, are there cases that are still pending? Probably, based on what you're saying. So similar to the first question with providers reaching out, so we can understand if it's unique to the provider or something that we're doing. If we could understand the same thing with the delayed payments, maybe it was the submission, the information on the submission, or something else. But we could work directly with them to figure out why payments, because most of the payments have moved to on-time status. The team is caught up, but clearly there are still issues. So understanding uniqueness or any uniqueness around those providers would be helpful.
Right, yeah, the issue last year is actually spurred, I believe there's legislation in this year to update our prompt payment laws just because of that situation that occurred. So we obviously want to make sure that doesn't happen. And again, for the folks that reached out to me, I'll have them reach out directly to you as well, and hopefully we can get that cleared up. Perfect. Any other questions? Seeing none, thank you all very much. We do have 2 panels of witnesses to come up, and I will call them as they're listed on my list. We'll start with Matt Rice from People on the Go, Laura Howell from Max, and Karen Adams-Gilchrist from the Providence Center. Mr. Rice, welcome. Please begin.
Thank you, Chairman Resnick, members of the House Health and Social Services Subcommittee. My name is Matt Rice. I'm the Executive Director of People on the Go of Maryland, Maryland statewide self-advocacy organization run for and by those with intellectual and/or developmental disabilities. POG is here in strong support of the Developmental Disabilities Administration budget because the majority of our members rely on services from the DDA, and we see that Governor Westmore and his new administration has made significant commitments to the Developmental Disabilities Administration budget. We want to make sure those are kept intact. There's funding for transitioning youth, people on the waiting list, and so many other things that, will benefit Marylanders with developmental disabilities and their families. I also want to make it clear that we really need to have the direct support, the rates for community services providers be where they need to be, because it is our provider community that is the backbone of the service system. While I self-direct, and that is a great alternative for many, it is not for everyone. And what we know right now, not to be too much on the negative side, but what we know right now is that there are people that would like to have provider services, but they're being forced into self-direction. People on the Go believes strongly that people have the right to choose, and providers should not have to turn anyone away, especially since they don't want to. So we really need to make sure that the rates are properly funded and where they need to be. So With that, please support the Developmental Disabilities Administration budget, and I'll take any questions you have. Thank you for your time.
Thank you, Mr. Rice. Ms. Howell?
Thank you, Mr. Chairman and members of the committee. I don't like going after Matt, but I guess I will. I'm Laura Howell, the Executive Director of MACS, the Maryland Association of Community Services. We are a statewide nonprofit association of about 120 agencies that provide community supports funded by DDA. Our members receive about 80% of the funding for community supports through DDA. We are very pleased with Governor Moore's FY24 budget, including the 12% rate increase tied to the acceleration of minimum wage and the $20 million for an increase tied to the rate setting process. I just have 3 points I want to make. The first one is, while much of the budget is incredibly bright, the status of rates for meaningful day services remains very concerning. And as Ms. Smith noted in her analysis on page 17, the rate setting process has gone well, with the exception of meaningful day services, and we have had continued concern about that. I'm a member of the DDA Rate Review Advisor Group. I'm grateful for that opportunity to participate in that group. We have a certified actuary whom we've been working with. We review each version of proposed rates, and there is no question that the issue of meaningful day rates needs to be addressed as soon as possible. We've been looking, as we've gone through this process, that maybe not addressing it until FY25, and it really is an issue that needs to be addressed sooner than that. The second issue is, I want to say DDA has taken a measured approach to the LTSS transition, which we've really appreciated, and it's really been crucial to the success of the providers who have made that transition to LTSS. Probably the biggest remaining barrier is, again, those meaningful day rates, because once you transition to LTSS, you have to accept those new rates, and the day providers who only provide day services, and you're going to hear from one in a second, it's too risky to make that transition. And then the last point is, there is one recommendation from the OLA that is troubling, and that is a recommendation that ARPA funds be recouped if there is no evidence of a positive COVID-19 test. This is for the isolation days. There was a higher rate for people who had to be isolated, but that was not the standard set by the health department, or really who drove it even more so were the local health departments. They absolutely said, and MDH policy was, you could isolate people and providers would receive the isolation rate for exposure to someone without knowing whether they were positive yet, waiting for the test results. Remember back when we had to wait quite a while for test results, or you were exposed to someone, or you had kind of a rolling exposure in a home, which also happened and led to long isolation periods, unfortunately. So we were concerned about that recommendation and hope the department will just, abide by the policy that they set around that funding. That's it. Thank you so much. This committee has always been so supportive. We are really grateful for it, and we urge you to support the governor's budget. Thank you.
Thank you. Ms. Adams-Gilchrist.
Good afternoon, Chairman Resnick and Vice Chair Chetty. I'm Karen Adams-Gilchrist, and I'm the President and CEO of Providence. It's a DDA licensed agency based in Anne Arundel County. We provide supports to approximately 270 people with intellectual and developmental disabilities, and we've been in service for serving our community for 60-plus years. I'm honored to testify today in support of Governor Moore's FY24 DDA budget. The supports and services that we provide are vital for the people to discover and live their best lives. And it is our direct support professionals that make this happen. They deliver on those supports. They're the ones that make our mission come alive, and they are the foundation of our organization. They are highly skilled, highly passionate people about the work that they do and the people that they support. They are more than caregivers. They are coaches, they are mentors, they're advocates, and they're supporting people to build relationships, to navigate their communities, and to be active members in their communities in whatever way is important to them. Our organization, like most of the organizations that are funded by DDA, is experiencing an unprecedented staff shortage. Our current vacancy rate is 30%, and we continue to have challenges with filling those vacancies, which means every person in need of support may not receive that support because we don't have the staff to do it. As rewarding as the work is of our DSP staff, it is also extraordinarily complex, and yet the pay earned by these professionals does not meet the skills required of them to do the job. We are absolutely grateful that the governor's FY24 budget includes a 12% rate increase to compensate for the proposed acceleration of the state minimum wage. While this funding won't allow for all of the funding needed for wages and to meet the high cost of inflation, it is critically important to the people who rely on us for support every single day. We urge you to keep this funding, as well as all of the expansion funding, in the budget. Now, as a provider of mostly meaningful day services, and as you heard Ms. Howell say, I would be remiss if I didn't raise the issue of the inadequate meaningful day rates that's proposed through the rate setting process. These rates are extremely concerning from a financial perspective, as well as from the perspective of our ability to transition into the LTSS system. We're anxious to do that, but the financial risk is far too great until the rates have been adequately addressed. So on behalf of Providence and the people we support, we thank you for your ongoing support and for allowing me to share.
Thank you very much for your testimony. Any questions for this panel? All right, seeing none, thank you all very much for coming to testify. We're going to bring up the second panel now. Andy Culp from the ARC of Maryland, Sharonda Huffman from the Maryland Inclusive Housing, and Tim Weens from Maryland Inclusive Housing. And Mr. Weens, rest assured you were successful in signing up accurately and on time. Please begin.
Hi, good afternoon, and Chairman Resnick and members of the committee. My name is Andy Culp, and I'm the Executive Director of the ARC Maryland. The ARC Maryland is the largest statewide advocacy organization dedicated to the rights and quality of life of people with intellectual and developmental disabilities, and the ARC organizations around the state collectively support more than a third of all people in DDA services. I'm here to testify in support of the governor's budget. I typically focus on transitioning youth issues, so I'll kind of stay with that tradition today. There is a going concern that we have with transitioning youth being able to truly make a choice in what kind of a model of services that they want once they exit high school. Matt Rice previously spoke to that, so I think you heard that. But that is our concern, is that with the deepening workforce crisis in the provider community, that providers aren't able to bring in transitioning youth at the rate they would like to. Many are still trying to fulfill the agreements they've made to the people that they already have in their services, and their workforce shortage is significant. So people are choosing self-direction with no alternative if they want to get timely services out of high school. So we do want it to be a real choice for people to go. Not everybody wants to self-direct their services. The other thing that it's not really DDA budget, but I think this committee needs to be aware is that the the Medicaid Eligibility Division Determination Division, EDD, not EVV. I'm sure you've probably heard of EVV issues too. There's a backlog of how they're determining eligibility for Medicaid services, and some transitioning youth are getting caught in that. Some providers are still supporting transitioning youth, and DDA is working to make sure they get paid, but they're not determined eligible for Medicaid yet, and you need to have that Medicaid eligibility and so we can get the federal match on their services. It's really important. And as the public health emergency is ending and the Appendix K flexibilities that we have unwind, people are going to lose that kind of continued Medicaid deemed status, and they're going to have to be redetermined. So that needs to be fixed, and I think that's somewhere between the Department of Health and everybody else. But we need to get that fixed so that there's not such a backlog and people can be redetermined on time. Thank you.
Thank you. Ms. Huffman.
I'm going to let my executive director go first.
Sounds good.
Good afternoon, Chairman Resnick, members of the committee. My name is Tim Weens. I'm the Executive Director of the Maryland Inclusive Housing, MIH. MIH is funded by DDA to assist individuals with IDD successfully attain and maintain inclusive, affordable, accessible housing of their choice. $250,000 is included in the proposed DDA budget to support our work, and we would ask you to support that appropriation. We are part of the statewide effort at transformation, moving people from a group home model to more of a supported living model. And so not that people can't be in group homes if that's working to them, but it seems like the future is more in supported living. So then where do people live? And that's kind of our task to figure that out. We have a more detailed description of our work in the written testimony that I submitted. We are also here to ask for additional funding for the DDA rental subsidy program, which began in FY23. It was part of this initiative to help people live in their own homes. And there was money for 35 people to receive these services in FY23, the current year, and we're recommending funding for an additional 100 people in FY24, and we don't see that in the budget yet. The cost of that annualized would be $1.9 million. Obviously, they're not going to be in services for the full 12 months, so it would be somewhat less than that, but we really need support to moving that forward. Our work as MIH can't be successful if there aren't resources for people to move into housing such as that. The rental assistance program, which is funded by DDA and administered through the Maryland Department of Disabilities and the Department of Health, Department of Housing and Community Development, we anticipate that will grow to over 500 people when it's fully developed. So it's a program that's in process and growing. The one other kind of request I would have of the committee is we submitted a plan to the Westmore Transition Committee to look at ways that we could partner with developers to create more affordable housing. And so we would just ask your support in encouraging the administration to work with us to develop that plan, to implement that plan in the coming years.
Thank you. Thank you for allowing us to speak today, because I was a little late, so I do appreciate you, Chair Resnick. My name is Sharonda Huffman, and I'm the Director of Housing of Maryland Inclusive Housing. I'm also a mother of an adult who has an intellectual and developmental disability. His name is AJ. He presently lives in a group home, and like any other Maryland, has a right to have a place called home. And I just want to say, to your point, my son was caught in the eligibility. He was an autism waiver, and it took some months, even though he was in crisis, in order to get him into a group home. My son actually regressed during the pandemic after graduating from high school in 2021. My son was actually hospitalized after I had to find someplace for him to go in Pittsburgh. And our family worked with our team, and we transitioned him to a group home. Luckily, I was working from home while I was going through that eligibility process. AJ now lives in an apartment with one roommate. I would love for him to have his own apartment with support. He loves living outside of our home because he is an adult and he wants independence. So I do support that we continue the DDA rent subsidy program. And it was an appropriation that was started, and let's just not stop it, because we also serve a lot of individuals who are looking for housing. And sometimes it's not necessarily a greatest model to live in a group home because you don't really have the options if you wanted to change service providers. So thank you very much, and I appreciate your time.
Thank you. Any questions for this panel? Nope, seeing none. Thank you all so much for coming to testify. We really appreciate everyone's testimony and your advocacy. Hope you're having a great Developmental Disabilities Advocacy Day. I know there's many of you here in the building, so feel free to stop by and meet with all of us, our colleagues, our friends across the street, and we look forward to moving out this budget. So thank you all very much, and we are adjourned.